about alcoholic liver disease. Hepatic steatosis is the first stage of this. This is also known as fatty liver. The steatosis is fatty liver because of the presence of small and large lipid droplets inside the hepatocytes. Initial centrilobular involvement followed by entire lobule involvement. Initially there is centrilobular involvement, then there is entire lobule involvement. The reversal occurs if abstinence from alcohol. If alcohol is not consumed, then this condition will be reversed. Now, alcoholic hepatitis is the second step of alcoholic liver disease. The second stage, having hepatocyte swelling and necrosis, ballooning degeneration, neutrophilic infiltration in lobules, perivenular and periportal fibrosis. Some hepatocytes show the presence of eosinophilic cytokeratin filaments called Mallory-Heron bodies. Alcoholic cirrhosis is the third stage, and this is irreversible stage. Initially, liver is enlarged and there is presence of micronodules and macronodules. Later, the whole liver has tough pale scar tissue, the Linux cirrhosis. Now, non-alcoholic fatty liver disease. It is condition that resemble alcoholic induced liver disease but occur in patients who are not heavy drinkers. Like men and women are equally affected. Association is strong association with obesity and dyslipidemia, hyperinsulinemia, insulin resistance, a spectrum of disease. The NAFLD, which is non-alcoholic fatty liver disease, include simple hepatic steatosis, fatty liver steatosis with non-specific inflammation. The non-alcoholic steatohepatitis. Some patients may develop cirrhosis. Patients are largely asymptomatic with abnormalities only in biochemical. Laboratory test, only the lab test comes abnormal, otherwise the patients are asymptomatic. Clinical significance of this is a cryptogenic cirrhosis. It also contributes to the progression of other liver disease like hepatitis C viral infection. Diagnosis is done by exclusion. The excessive alcohol intake has to be excluded. Liver biopsy is the most important diagnostic tool. It is also associated with AST and ALT ratio less than 1. Aspartate transaminase upon the alanine transaminase ratio less than 1. Alcoholic steatohepatitis, the same ratio is more than 2 in the alcoholic steatohepatitis. Clinically, the patients are asymptomatic with the elevated enzyme levels. Cardiovascular disease is frequent cause of death.